Welcome to our first podcast on the digestive system, and we are going to begin this story looking at the oral cavity. As you can see, we've got a long way to go to get from the top to the bottom, and we've got some generalized plans that we're going to go over as far as the alimentary canal. But first, the oral cavity. And so we're going to identify the regions of the lip. We have the external portion that's similar and continuous with the face, the inner portion continuous with the oral mucosa, and then the transition zone of the lip, which is the pink part. Then we'll talk about the tongue, and we'll need to identify the different papillae on the tongue, their shape, their histology, and the function of each. And then we're going to look at the taste bud, the cells that comprise the taste bud, and the function of each of those. So, as I've mentioned, the digestive tract, we begin in the oral cavity and we literally go to the end of the story through our alimentary canal, esophagus, stomach, intestines, rectum, and then anus. And then in this section, we're also going to discuss our associated glands. We'll have our salivary glands in the oral cavity, pancreas, liver, and gallbladder. We include gallbladder. It's not really a secretory gland. It's going to be more of a reservoir to hold and concentrate material. But we include the gallbladder because it's part of our biliary apparatus along with the liver. So here we see our plan for our alimentary canal, our oral cavity on the left. We can see our alimentary canal, the various accessory organs, pancreas, liver, gallbladder on the right. So with the digestive system, we have a number of functions, and this is certainly the place where we're going to ingest our raw material, and we're going to begin that processing of the raw material by mechanically breaking down the food, and that process is called mastication. And in the process of mastication, our tongue is going to be used for intraoral transport. It's going to move this material around so it can be ground much better, but it's also going to be moved toward the back of our oral cavity into a pharyngeal region, and this is where we have deglutition, the swallowing of food. It's not something we necessarily consciously think about as we're chewing and eating, so the tongue is going to be important for that process as well. Now, the chemical digestion of food also begins in the oral cavity. This is where we have the addition of our enzymes from salivary glands. We're going to continue that in the stomach. We'll also continue to pump enzymes in from our pancreas once we get to the first part of our small intestine, the duodenum. But largely, the rest of the intestinal tract, the alimentary canal, is going to be responsible for the absorption of nutrients, materials, the absorption of water, and then at the very end, this is going to be for the storage and elimination of indigestible materials. So again, we begin in the oral cavity. Now, in the oral cavity, we are going to look at the lining of the oral cavity, and for our generalized plan, this is termed the mucosa. So it is an epithelium, yes, and so if we pointed to this layer, then we would be talking about our stratified squamous epithelium, and that's going to be our oral mucosa. Now, we have two different types really when we look in the oral cavity. We have that's really associated on the tongue, and that's a lot of our papilla, and this is going to be a keratinized layer. And underneath, we're going to have dense irregular collagenous connective tissue. But if you look at the roof of the mouth, for instance, or if you look at the side of your cheeks, the lining inside your mouth that's your cheeks, this is going to be stratified squamous parakeratinized epithelium because you don't have those same frictional forces that you have on the surface of the tongue. Now, our specialized mucosa, that's where we're going to look at the sensory structures that make up our taste buds, that help us sense taste. And we'll look at those specifically as we move along. Now, prior to getting into the oral cavity, if we're starting with the outside of the body, we have to pass this anterior boundary, this sort of guardian or gate of the oral cavity, and these are our lips. And our lips are really defined because of a skeletal muscle that completely encircles the oral cavity, and this muscle is called the orbicularis oris. And in this illustration, we can see a number of the facial muscles present, but in blue, this is our orbicularis oris. You can see its origin, its insertion, and really the action is multiple because we purse the lips, we pucker the lips, we close the mouth. All of those features are going to be a function of the orbicularis oris. Now, as we look at the lips, we're going to have an outer part that is continuous with our face, the skin of our face. We have the inside part, or the mucosal aspect of the lips, and this is going to be the same and continuous with our oral, non-frictional mucosa. And then we have a transition zone that's called the vermilion zone. And the vermilion zone is really what we think of when we say the lip itself, the pink part. That is the vermilion zone. And so in this red line illustration, we can see the outside of our body here. This is going to be exactly like our thin skin as we come up the surface of the face. Now we still have this outer part of the lip. And so this would be moving down toward your chin. And then here is the pink part of the lip. This is where it begins, and this is the vermilion zone, the boundary between our thin skin and our oral mucosa. And you can even see the papilla start to change shape quite a bit in this region. We're going to have much more of these dermal papillae because we're going to have capillary loops in these papillae, and that's what gives our lips that reddish color, because we have a number of blood vessels much closer to the skin here than we do in this region. Now in this cross section, you'll be able to see hair follicles. You can see sebaceous glands. All those things identifiable as thin skin. We're going to see our stratified squamous non-keratinized epithelium on the oral portion inside of our mouth here. And then when we see skeletal muscle running right down the middle, we know that this is our orbicularis oris muscle. So the external part of our lip, again, same as thin skin. Stratified squamous keratinized epithelium, sweat glands, hair follicles, sebaceous glands, everything we come to expect. And if you were to look at this level of magnification, you would be hard-pressed to know, are we looking at thin skin? And where on the body exactly are we looking at with this thin skin? Here we can see our keratinized epithelium. We can see our papillary and reticular layers, a lot of collagenous fibers here. We've got some adipose tissue, hair follicles, sebaceous glands. These are actually sebaceous glands, and we have a hair follicle in the center. Here we actually have a hair follicle and its sebaceous glands, and you can see where that's opening on the surface of the skin. The vermilion zone, this is the one that we are least familiar with when it comes to histology, because this is the transition. It is covered by thin skin, but we're not going to see sweat glands, hair follicles. You may see some sebaceous glands. So really, we are transitioning from thin skin and all those characteristics we think of with thin skin to our oral mucosa. And really, in this region is where you're going to see this very expanded reedy apparatus. All of our dermal papillae projecting up into the epidermis. That's because of the capillary loops that are present there. So in this particular micrograph, we're moving from our external characteristics on the right toward our oral characteristics on the left, and this is going to be our vermilion zone. And again, you can see all of these papillae, very extensive reedy apparatus with our capillary loops present here. And you can see our keratinized layer really going away, and it's gone by the time we get to this. So that is our transition or vermilion zone, the pink portion of our lip. Once again, here we have skeletal muscle, and since we're in the lip, that's going to be the orbicularis oris muscle. The internal aspect simply is our perikeratinized epithelium. And again, we're not going to necessarily be able to distinguish just that epidermis to know where we are, whether we're talking about oral mucosa, whether we're talking about a different place where we have perikeratinized. But we can get a hint, because when you look down in the dermal layer, we're going to see minor salivary glands, and many of these are going to be mucus type salivary glands in nature. And so once again, as we look at our perikeratinized epithelium, stratified squamous, we've gotten that since the very beginning of the semester. Here we have skeletal muscle, orbicularis oris, and here we have an accumulation of mucus glands. You can see these acini are very pale nuclei along the base. Here we have some fairly large ducts. So these are some of our minor salivary glands. Now we'll be talking about salivary glands as we get toward the end of this unit when we talk about our accessory glands. But this is going to be one indication that you're not looking, let's say, in vaginal tissue, but you're looking at oral epithelium because of these minor mucosal salivary glands. Now, we're not going to go over teeth. Teeth have their own unique features, and we're going to leave those for dental school. But we are going to talk about the tongue because this is extremely important. It's the largest structure we have in the oral cavity, and it's going to be involved in chewing, swallowing, speaking, and really our intraoral transport, moving this material back and forth in the position of our teeth. That's the real critical function. And if you've ever wondered about that, just think about how many times you've bitten your tongue when you're chewing something and wonder, why is the tongue getting in the way? And why don't we do it more often? Well, that's just the coordination of chewing and the tongue moving the material in place but staying out of the way. Now, I always like this picture because tongues come in many different sizes and shapes, and Gene Simmons certainly is one of those that, he just doesn't even look the same once he puts the makeup on. But we are looking at this structure we know as the tongue. Now, all of the muscles in the tongue are going to function in different ways, and we have a number of them that we're going to talk about. We have some muscles that are extrinsic in nature, and that means they're going to be connected outside to a bone, for instance, and then they are a part of the tongue. So one of our extrinsic muscles is the genioglossus. And this is going to essentially be the body of the tongue itself. Its origin is on part of the mandible, and its insertions are on the hyoid bone, and to a limited extent, the dorsum of the tongue. And it's the genioglossus that's going to allow us to protract the tongue. And if you can't remember some of these actions, protraction is where we're going to extend this away. So sticking out your tongue is protracting the tongue, and that's a function of the genioglossus muscle. Now the hyoglossus, and again we can see that colored here in the orange, its origin is on the hyoid bone again, insertion the lateral sides of the tongue, and the action here of the hyoglossus is to help us depress the tongue or lower it into the floor of our oral cavity. The styloglossus, again we've got the styloid process as its origin, insertion the sides of the tongue. And in this case, this is going to allow us to retract and elevate the tongue. So we're going to pull the tongue back into the mouth after we protract it out. This retracts back in, raises the tongue, making almost like a ramp. And so this one's going to be extremely important in the initiation of swallowing and the deglutition of food as we're chewing it. Now, intrinsically, these are all the muscles that are just simply contained within the tongue. And so we have four groups: the superior, inferior, longitudinal, vertical, transverse. And these are going to align along our different planes that we have. And these are the muscles that allow the curling of the tongue. And I know some of you have done this in genetics. You curl the tongue. Some people can, some people can't. And then some people are extremely creative and can make the clover leaf with their tongue. And this just really shows you all the different muscles that are present in the tongue and how they can potentially be used to have the tongue do very intricate maneuvers such as what you're seeing here. Now, as we look on the surface, or the tongue as a whole, we can divide the tongue really into two major parts: the oral portion and the pharyngeal portion, or the anterior 2/3 and the posterior third of the tongue. And so the oral portion is going to extend from the sulcus terminalis, and this really is going to be a developmental term, but we'll look at this in an illustration in just a bit. But the sulcus terminalis to the tip of the tongue is the oral portion. From the sulcus terminalis back to the root of the tongue, that's going to be the pharyngeal portion. And the very most posterior portion, or the most proximal to the body itself, this is going to be the root of the tongue, where we're actually anchored into the body. So in this somewhat older illustration, we can see that we've got the tip, or the apex of the tongue. This is going to extend back in this sort of V-shaped dividing line. This is the sulcus terminalis. And this is going to be the division between the oral portion and then the back, we have the pharyngeal portion, and the root of the tongue is back here. Here we have the epiglottis. This is showing on these lateral sides of the pharyngeal compartment. We have the palatine tonsils. We're going to have our lingual tonsils in this region where we have some of our leaf-like structures, our foliate papillae on the side of the tongue. Now, these papillae, these are going to be structures on the surface of the tongue, and some have different functions than others, but they're going to divide into 4 groups based on their histological appearance. We have the filiform, the foliate, fungiform, and circumvallate. And so as we look at illustrations on the surface of the tongue, we can see many of these. The ones that are simply spike-shaped, these are going to be our filiform papillae. Some are going to be rounded on the surface. These are our fungiform papillae. Some are going to be extremely large that have a ring encircling them. These are our circumvallate. And the last ones that we don't really see here, but we'll see in some illustrations, are our foliate, or leaf-like, or layered papillae, and those are going to be on the lateral portions of our tongue, toward that back third of the tongue. But we're going to start with the filiform papillae, and these are covered by stratified squamous keratinized epithelium, and these make up the majority of the surface of the tongue. There are no taste buds on these because they're covered with this stratified squamous keratin. And if you've ever had a kitten lick you and you just feel the rough surface of that feline tongue, those are the filiform papillae. And actually in the larger prey cats, the lions and the tigers, these filiform papillae are so tough they can actually rasp the meat from bones. And so these structures are not just present for looks and decoration. They're there for functional significance, to pull material off of a prey item to ingest it in the body. Here you can see in this scanning electron micrograph these spike-like structures on the surface of the tongue, and these are filiform papillae. Now, at a light microscopic level, again, we can see the spikes of our filiform papillae, and you can see the stratified keratin layers on the surface of these. So these are our filiform papillae in cross-section, looking with an H&E stain. Now, much less frequently, we're going to see fungiform papillae. Fungiform, resembling a fungus or a mushroom. And these are not going to be keratinized. These are going to be parakeratinized epithelium on the surface, and these may contain taste buds. And typically the taste buds are going to be seen on the cap or the top of our fungiform papillae. And again, these are going to be much less common throughout the tongue as the filiform were the most abundant. Here we see a scanning electron micrograph, again looking at the surface of this, and some of these pores that we see in the surface of this fungiform papillae may in fact be little channels or openings to allow chemicals to get down to the taste buds. And we'll look at those as we get toward the end. But here in a light micrographic view, we can distinguish between our filiform papillae, very heavily keratinized, these spike-like structures, and then our fungiform, we can see this rounded dome on top, again, much like a mushroom. And in this region, we may see some taste buds, and actually, I'm not sure if we're going to get some taste buds here. We'd need to see them in a little higher magnification to be able to see them. But we will take a look at the taste buds coming up. The circumvallate papillae, these are going to be very close to that sulcus terminalis, and we only are going to have a few of these, maybe 8 to 12 in nature. And you saw the big rounded cap in the center surrounded by the circular rim, creating essentially a moat or a channel between the ring and between the cap of a circumvallate papillae. Now, it's going to be down in this groove where we find on the lateral surfaces where we do find taste buds on this circumvallate papillae. And it's also at the base of this groove that we see serous glands emptying materials into these spaces, and these are called glands of von Ebner. This serous secretion is going to help wash material out of this groove. It's also going to help to dissolve chemicals into this liquid media to get them into the taste buds for that detection. So here we're looking at a cross section of the tongue, and most of what we see are our filiform papillae. But then all of a sudden we see this large, again, mushroom-shaped papillae with a large groove on either side. These are our circumvallate papillae. And we're going to look at the lateral profiles of these. Once again, here we have the large cap, paracaratinized again. Here we have the grooves. These are going to be our von Ebner's glands down here at the base, these serous glands that are emptying into these grooves. And here on this lateral surface, these are going to be our taste buds. We're not going to find these on the cap. We're just going to find them on the lateral portion of our circumvallate papillae. This is a scanning electron micrograph. It's showing the cap in the center. Here's that groove where we're going to get down to the lateral portions where we have our taste buds, and then here's the ring surrounding that. That's our circumvallate papillae. Now the last ones are the foliates. We don't have real good light micrographic images of these, but these are going to be on the lateral surface. Again, they look like rows or leaflets, hence the term foliate. And really, you're not going to see taste buds on these very much at all. You may have some von Ebner's glands, but really, you're going to examine these and identify these on an external gross anatomical view. And so if this is the dorsum of the tongue, this is a lateral portion of the tongue, these leaf-like folds you see as you get back toward the pharyngeal portion. Back in the region where we're going to have our lingual tonsil also, this is where we're going to see our foliate papillae. Now, last, taste buds. With our taste buds, this is where we're going to see all of the cells that are involved in the detection of chemicals that we recognize as taste. And there's approximately 3,000 taste buds in the oral cavity, and maybe as many as 60 to 80 cells per barrel-shaped organ we know as a taste bud that comprise the taste bud itself. Now, these taste buds are comprised of 4 different cell types: dark cells, light cells, intermediate, which really are based on their histological appearance and staining pattern of color. And then we have our regenerative cells, or the type 4 cells that are present at the base of our taste buds. Now, these type 1, 2, and 3, basically these cells are going to progress through a life cycle. And so as we look at the dark cells, the intermediate cells, light cells, this appears to be the pattern with which they mature. So basically basal cells, the regenerative cells, become dark cells. The dark cells will mature into light cells, and then the light cells become the intermediates in that staining before they die and need to be replaced. Now, these cells also function in some ways as receptors because they have synaptic junctions. So you have nerve endings at the base of the taste bud, so that when these type 1, 2, and 3 cells detect a chemical, they release chemicals, neurotransmitters. That's going to be picked up by the nerve ending, and that's going to send the signal that you are tasting something by these detecting cells. Now, the detection happens because these 3 cells will send microvilli. Now, they call them taste hairs, and often we think of cilia and hair as being similar, but really none of them are the same. But these microvilli are going to extend through the paracaratinized epithelium through a little opening called a taste pore. And it's going to be these microvilli that have receptors for the chemicals, the tastants, to interact with those receptors so we can start the process of signaling that we have in fact tasted something. So here's our illustration looking on the lateral border of a circumvallate papillae, or even on the cap of a fungiform papillae. We have a taste bud. Here is the taste pore, these openings, and here the microvilli or the taste hairs that are sticking through. Again, these are where the receptors happen. We have our different types of cells present in here, our dark, light, intermediate. We have our basal cells along the bottom, and then here's our sensory nerve fiber projecting up in to detect the neurotransmitters released from our taste bud cells to send that signal on to the brain. Again, this is what we see at the light level, and for our purposes, we're not going to distinguish light, dark, intermediate cells with a taste bud. We can see almost the hint of a taste pore in this case, but these barrel-shaped, rounded type structures are our taste buds. Here again we have an illustration and a transmission electron micrograph showing the distinction between some of these cells. Here we can see our 1, 2, and 3. They include a 5 here, and unless these are just the capsular parts of these, I'm not sure what 5 is. Here we have our regenerative cells, and then here you can see the synapses happening between the type 1, 2, and 3 cells and our sensory neurons. And you can see these are myelinated neurons extending and leaving from the taste bud. Here we're only looking at the dark cell, the light cell, and I'm not seeing the intermediate cell labeled in here at all. And then we get down here to our regenerative cell. Now, the tastes that we can detect used to be 4. We've just recently added the 5th. We know salt, sweet, sour, and bitter, but recently umami was added, and umami is said to be a savory type of taste. Now, each taste bud is going to specialize in 2 of the 5, but any taste bud can detect any of these 3. However, the signaling with which they do this is slightly different. The salty and sour detection is facilitated by ion channels in our type 1, 2, and 3 cells, but bittersweet and umami, these tastes are facilitated through G protein coupled membrane receptors. So you have different mechanisms with which we taste these different tastants, and we sense what taste really is. And any taste bud can do any of the 5, but again, specializing in 2.